Insert the PATRAN berry slide sheet under the linen the patient is lying on, in this case a draw sheet, using the unfolding method. Detailed videos on this method are available on the PATRAN website. It will likely take more than 2 caregivers to safely move large patients. If the patient can be pushed on, put extra caregivers on the pushing side. Move the cart next to the bed. Make sure the cart is elevated a few inches lower than the bed and lock the wheels. The patient is centered on the PATRAN berry, so the puller must roll up the linen with the PATRAN berry. If there's only one puller, that caregiver acts as a guide because of the stretched out position. The pushers put one leg behind the other, press directly on the patient, and push the patient across to the cart. After transferring the patient, there are 2 options. 1, keep the PATRAN berry under the patient for transport and procedures if the patient will be attended, or 2, remove the PATRAN berry if the patient will not be attended.
All right, Jason, we're going to boost you up in bed. This is going to be a 2-person dependent boost for a patient who cannot do anything for themselves. So we're going to do this together. First thing we're going to do is raise the bed height so that it's good for our body mechanics. And you want the height of the bed to be between knuckles and rib cage for both caregivers the best that you can. So this should be good for both Jamie and I. The next thing we're going to do when we do a 2-person boost, we don't want to be lifting. So what we're going to actually do is we're going to do a standing weight transfer. So we're going to hold the draw sheet on top of the slide, and we're going to take our weight from the back leg, which is closest to the patient's knees, and we're going to actually shift our weight with the patient in a sliding motion towards the head of the bed. So we're going to count 1, 2, 3 and then take a step. Are you ready, Jamie? All right, you ready, Jason? Okay, here we go, starting with our weight on the back leg. 1, 2, 3.
So we're going to show you how to use a PATRAN XS slide sheet to insert a mobile or portable imaging device. So I've got my cassette here, and I'm just sticking it right in the tube and wrapping the PATRAN around it. Nothing fancy. It's radiolucent. But we understand that techs often have to do this by themselves. So you can make this a 1-person job. If you're wanting to do a chest x-ray, you take your wrapped imaging device and you slide it right in behind the patient. That will protect the cassette, make it easier, slipperier for the cassette to be inserted, be more comfortable for the patient. Do your imaging, and then slide out the entire package. I'm now going to show you how another alternative way to insert the mobile imaging device or your portable x-ray cassette. Depending on where you want to insert it, if you want to insert the device behind the fitted sheet and between the mattress, you want to take up the fitted sheet on the one side and start sliding in your tube. Then I'm going to go to the other side and do the same thing. Free up the fitted sheet and pull down the PATRAN. We're going to pull it down to just about his lower back. I'm going to go back to the original side and do the same. Now, this is the side I'm going to insert the cassette. So I want to pull the entire tube toward me so it's hanging off. It's offset here. I am going to grab the 2 layers and keep them apart and slide my cassette right into the tube and just push it right in behind the patient. Adjust it however I want. If the patient is maybe slumped the wrong way, the PATRAN will also help you to gently move the patient into the position you want. If you decide that's not the position I want the patient, I need to do a new image, take out the cassette. You can leave the PATRAN in, move your patient how you want, and then reinsert the cassette. Maybe you want it a little higher this time. Now I'm done. I pulled out the cassette, and I'm pulling out the PATRAN. You can just simply pull it, but if any of their skin is exposed, you want to turn it under itself before you pull it out.
Fold a PATRAN in half or smaller and place it on the seat of the vehicle. Tuck the PATRAN so it doesn't hang out of the vehicle door. Assist the patient to the vehicle. Assist the patient into the vehicle and secure the seat belt. Assist the patient into the seat, making sure she doesn't hit her head on the door opening. Using the slip of the PATRAN, some patients may be able to pivot on the seat, while others may need assistance with their legs. Fasten the seat belt. Pull the PATRAN at the front and back edges of the seat to remove it. Assisting the patient out of the vehicle using the PATRAN slide sheet. Fold a PATRAN in half or smaller and tuck it under the patient sitting in the vehicle. Remove the patient's seatbelt, pivot the patient's legs out of the vehicle, put a walker, wheelchair, or lift device in place, and assist the patient out of the vehicle.